Hi, my name is Jackie Rutino, and this is my patient Aneo. He's agreed to help us out today for our head-to-toe assessment for Nursing 612 Advanced Health Assessment. We're going to start by, I did his vital signs, measured his height and weight, calculated his BMI. He's emptied his bladder. We did the near vision screening with the Snellen chart. No, the near vision screening with the Rosenbaum chart, and the distance vision with the Snellen chart. And he's put on some comfortable clothing, and I washed my hands. We're going to get ready to go here. So we'll start the assessment by just a general observation of him walking in, and then we start with his head. And notice his hair is well dispersed over his head. His facial features are nice and symmetrical. His ears are even with the outer canthus of his eyes. He has no visible lumps, bumps, lesions, no visible acne, scars, suspicious nevi on his face. And then we're going to go ahead and palpate his head and his scalp, feeling for any lumps or bumps or irregularities, any tender spots. And feel that his hair is nice and smooth, it's not brittle, there's no like patchy baldness or anything. And then we're going to go ahead and move on to his face here, palpate his facial bones for any tenderness or pain with the palpation here. As we're working our way down, we're going to palpate the sinuses, the frontal sinuses and maxillary sinuses for any pain or tenderness, and his TMJ. Have you open and close your mouth a couple times? Checking for any clicking or popping or pain or tenderness. His muscles are nice and firm there in his jaw. And then after that, we're going to go ahead and move on to his eyes. Looking at his eyelids are not drooping at all. His eyelashes are growing out and away and up, away from his eyes. His eyebrows are nicely dispersed there. Looking at the conjunctiva, nice and pink and moist, and the sclera are white with no jaundice appearing there. And then we're going to go ahead and do a cover and uncover test on his eyes. I'm going to have you focus on a point across behind me here and cover your right eye and cover your left eye and uncover. I'm looking for any jumping or nystagmus in his eyes at all there. And then we're going to go ahead and check his pupillary response. So just look straight ahead there, and I'm going to check direct and consensual and direct and again consensual there. Looking that his pupils are responsive to the light. I'm just going to have you watch my pen here, not moving your head. I'm going to have you follow with just your eyes, checking the movement of your eyes here, with making sure there's no jumping as we move through the cardinal fields of gaze here, in all 6 cardinal fields of gaze. Down and then in towards you to watch your eyes there. So then that was all good. And then we're going to go ahead and look at the red reflex in his eyes. And we'll try each eye here, just looking the red reflex there. And the red reflex in this eye. And that's good. I can see it in both eyes. So then we're going to check a couple of your facial nerves, the cranial nerves that control like some of your facial features, the facial expressions that you can make. So I'm just going to ask you to do a couple of things. I want you to squinch up your eyebrows, raise them, and then close your eyes real tight. Okay, go ahead and open. Then I'm going to have you smile real big. Okay, stick out your tongue at me. Move it from side to side. Okay, and then clench your jaw real tight. And then lastly, just puff out your cheeks. Okay, and then I'm going to check a light sensation here. Close your eyes, and I want you to tell me where I touch on your face and when, okay?
Left forehead, right cheek, left chin.
Okay, that was all good there. And then we're going to go ahead and move on to your ears. So looking at his ears, I already noted that they were even with the outer canthus of his eyes there, and they don't appear to have any big nodules or lesions or anything on them. Just looking at him, and then we're gonna go ahead and palpate the auricle. I'm checking for any pain or tenderness. While we're doing that, we're also gonna look behind the ears and make sure there's nothing hiding back in there. And then I'm gonna test a little bit of your hearing. So I'm gonna do what I would call a whisper test. I'm gonna go behind you, I'll whisper a word, and you tell me what I say.
Orange.
And then the other ear here.
Apple.
Okay, good. And then I'm gonna go ahead and do a couple other tests on your hearing, some bone conduction and versus air conduction kind of things. So the first one I'm gonna do is I'm gonna strike this on my hand and hold it on top of your head. And I want you to tell me if you hear the sound the same in both ears or better in one or the other, okay?
Same in both.
Okay. And then the second one, that's called the Weber test, by the way. And then the second one is called a Rene test, and it is the bone versus air conduction on the same ear. So I'm going to strike this on my hand, hold it on the bone behind your ear, the mastoid bone, and you tell me when that sound stops. Then I'll move it in front of your ear, and then you'll hear a noise too, and tell me when that stops. That's the air conduction. Okay.
Okay. Ready?
Okay. And then, by the way, the air conduction is supposed to be twice as long as the bone conduction, which yours was, so it's nice and good there. We would do that on both ears, but for the sake of time today, we're just going to do the one ear for our demonstration. So next, I'm going to look inside your ears. We're going to look at the tympanic membrane. I'm going to look at the color of it. Should be nice and pearly gray, which yours is. I don't see any discharge, any growths in the ear canal. I can locate the bony structures are very visible there in your ear too. So that's good. Again, we would do both ears, but for the sake of time today, we're only going to look in one. You lucked out. So then I'm going to go ahead and move on to your nose. So looking at your nose, it's nice and midline. It's not deviated, septum's not deviated one way or the other. So then just to test that you can breathe out of both sides, I want you to plug one side, take a nice deep breath in and out, and plug the other side, nice deep breath in and out, good. And then I'm going to look inside your ear, or your nose. Go ahead and look up for me. So I can see some turbinates, but they are not inflamed at all, not red. I don't see any signs of any other growths or polyps or anything up in your nose, and no discharge, nice and pink and moist up in there, which is good. So then we're going to go ahead and I'm going to move on to your mouth. So looking at his mouth, his lips are nice and pink in color, nice and moist. I don't see any cracking or chapping, no sores in the corners of your mouth or anything. So we'll go ahead and get a light here so we can see real good inside. So I'm just going to have you open your mouth for me and look up a little bit. Stick out your tongue, say ah.
Ah.
Okay, it's barely visible tonsils there. The uvula rises and falls there when he says ah. I can see his soft palate and hard palate is nice in color and no lesions or change in color at all. Inside of his cheeks are nice and same color all around, no white patchiness or anything. Same with his tongue, which is nice and symmetrical in size. I'm going to look down the sides of his tongue to ensure there's no change in color or patchiness or any no cancers on the tongue or anything. Go ahead and lift up your tongue for me so I can see underneath there too, and we'll make sure there's nothing hiding under there for us. His teeth are nice and white in color. There's no chipping or cracking. I can't see them anymore. But no chipping, cracking, or missing teeth or anything at all. go ahead and open your mouth for me again. I can see the anterior posterior pillars and the oropharynx back in there look good too. So that's all good inside your mouth, and I'll stop looking in there then. I want to check your gag reflex as well while we're doing this. So go ahead and open your mouth, checking your gag reflex. Okay, that's that. And then we are going to go ahead and just keep on moving on. So looking at his throat, I can see, and his neck is nice and symmetrical on both sides. I don't see any bulging, no big goiters evident or anything. I'm going to check the range of motion with your neck there. And so I want you to first put your chin on your chest. Go ahead and look all the way up for me. Put your right ear to your right shoulder, left ear to your left shoulder, and go ahead and shrug your shoulders for me. Okay, now we're going to do all those movements again, except I'm going to do a little resistance, checking your musculature there. Go ahead and chin on chest. Okay, go ahead and look up. Right, left ear to left shoulder, right ear to right shoulder, and shrug your shoulders. Okay. Good. Any pain or tenderness when you're doing any of that? It's nice and strong. Are you pushing me over? So then I'm going to go ahead and palpate, making sure that your trachea is midline and checking that. I'm going to check your carotids, your pulse on both sides, one at a time. Nice and strong there. And then I'm going to check your thyroid. So I want it to turn a little bit for me so I can check that it's nice, and go ahead and swallow for me. Okay, do go again. Okay, it rises and falls with swallowing, and I don't feel that there's any, it's nice and smooth. There's no like big bulging and rough feeling or pebbly or anything, so feels good. So then I'm going to listen to your carotids and your thyroid. So when I listen, I want you to just hold your breath, okay? And the other side. And thyroid. Okay, you can go ahead and breathe then. So that's all good. And then I am going to just keep on moving down, but first I'm going to check your nodes, your lymph nodes. So I'm going to do the preauricular, post-auricular, the occipital, tonsillar, submandibular, submental, the superficial and deep cervical chains. I'm going to check the supra and infraclavicular as well. I'm going to move on down and I'm going to check axillary nodes. And this side. Okay, that's all good. So then I'm going to do your upper extremities. So I'm going to look at your arms and note that they are nice and warm in color, and I don't see any evidence of suspicious looking moles or anything. And I'm going to check your pulses. So checking your brachial pulse and your radial pulse, bilateral. I'm going to look at your hands and your fingernails, noting there's no cracking or chipping of your nails or clubbing of your nails. I'm going to check capillary refill. That's less than 3 seconds on both hands here. Again, no cracking, chipping, peeling, breaking, or clubbing of these nails. And cap refill is good there too. I'm going to check that your strength is good. Squeeze, yep. And push up on my hands. And push down on my hands. Good. Now we're going to check your reflexes. So I'll check here. And then check here. Again on this side. Just checking that that muscle twitches here. That's good. All right. So then I'm going to go ahead and I'm going to check out your chest and listen and feel around a little bit. Your hair is nicely dispersed across your chest. There's no uh, patchiness or hair falling out or anything, and it's not real brittle or cracking and breaking. So then I'm just going to palpate, make sure there's no tenderness anywhere here. I'm going to feel for the apical pulse, for the maximal impulse here. And then I'm going to check for tactile firmament, feeling the vibration when you talk. Okay? Go ahead, say 99 as I move my hands down.
99, 99, 99, 99.
Okay, good. And then I'm just going to listen. I'm going to listen till you breathe a little bit. First, actually, I'm going to do some percussion. So with this, I'm just going to palpate systematically across your lung fields, listening for any change in sound that would tell me that there is air or fluid in your lungs at all, okay? So, and then laterally here. And a nice resonant sound all the way throughout. No hyperresonance or symphony going on. So, or dullness. Hyperresonance or dullness going on. So then, now I'm going to go ahead and listen. Just take some nice deep breaths as I listen through the lung fields here. Okay, now just breathe normal. I'm going to listen to your heart sounds. The aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, good. And that's all on the front, so I'm going to have you turn around so I can do about the same thing on your back there. So again, we'll start with inspection. I'm going to look and make sure there's no suspicious looking moles, any lumps, bumps, anything that looks out of the ordinary. So then after that, I'm going to feel he's nice and warm and doesn't appear to hurt him at all when I palpate his back. I'm going to go ahead and percuss through the lung fields again. So systematically throughout the lung fields, we're going to do the same thing, looking for any change in sound as we percuss through here, listening for any fluid or air-filled pockets or anything. So once that's good, I want to check the expansion and making sure his lungs expand well. So I'm going to put my hands about at the level of the 10th rib here. I'm going to have you take a nice deep breath in and out. And that's I'm just looking to make sure that both sides expand nice and evenly when you take your nice deep breath there. Now I'm going to check your diaphragmatic excursion. And what that means is I'm going to palpate down from the top and listen for the change from resonance to dullness, noting where the diaphragm is. And then I'm going to palpate back up, noting the change from that dullness back to the resonance. And we're going to measure that area there. So again, palpating down. Blocking my camera, but I'm going to go ahead and mark that spot there where the change is in sound. And then I'm going to go from that point. Oh, take a nice deep breath. That's what I forgot. Take a nice deep breath in. So we'll start at the top again so we can see on the camera the same. Hold your breath in. And palpate down to where, go ahead and release. I'm going to go ahead and mark that spot. And then now that take a nice deep breath in and out, exhale everything. I'm going to go from where we marked before, palpate back up to where that sound changes again and mark there. And then we're going to measure that area. And that area should be between 3 and 5 centimeters, which yours is about 4. So then that would be the distance there. We would do that on both sides, but again, we're not going to for sake of time today. I'm going to go ahead and I'm going to listen to your lungs again. So just nice deep breaths in and out. And lateral. Good. Okay. Now I'm going to go ahead and have you just lay down on your back. And we're going to start with your belly here. So looking at your abdomen, it's nice and even, the contour. I don't see any big lumps or growths or look like bulging or anything that might be wrong just at a quick glance. And then I'm going to go ahead and I'm going to listen, making sure that I can hear your bowel sounds in all 4 quadrants. If I wouldn't hear anything at all, I'd have to listen for about 5 minutes in each spot, making sure that I don't hear anything to say that you would have absent bowel sounds altogether. I'm going to go ahead and listen to your aorta while we're here. Your left renal and right renal arteries. Your right iliac and left iliac. Left femoral and your right femoral. Good. And then I'm going to go ahead and I'm going to palpate for your aorta. No pulsating, no real big pulsating or anything. No movement across your belly, just looking at it. Okay. And then I want you to raise your head off the bed there. I'm going to note that there's nice firm abdominal muscles there, I can see. And then go ahead and lay back down. And then we're just going to palpate your liver borders, which I'll start in an area of a tympany sound and palpate up for the change in sound there. And I'm going to mark there. And then I'm going to do the same from up and down and mark here. This should be, if I'm measuring at mid-clavicular line, should be between 6 and 12 centimeters, which your liver border is about 6. If I did it mid-sternal, it would have to be between 4 and 8. So we're just moving right along. We're going to palpate over the spleen there for making sure it's dull sound. And then I'm going to palpate your belly real lightly, noting any tender areas or anything going on. And then we'll go a little bit deeper for any tenderness, or see if I can feel any of your organs that are enlarged or anything. I'm going to go ahead and feel for the liver border and your right kidney, your left kidney, and try to, for your spleen there, but you shouldn't be able to feel it, which I cannot. Okay, well that's good. And then I'm going to go ahead and I'm going to have you sit up. Spin your legs back around here. One last thing we're going to look at is your lower extremities. So looking at your lower extremities, I can see that you have a nice muscle tone in your legs. The hair is well distributed. No patchiness again. I don't see any visual signs of any like suspicious nevi or anything going on there. Vascular patterns are good. No redness, no swelling at your joints, or no edema here along your tibial line or at your ankles. I'm going to go ahead and have you show me your feet, good in color. Cap refill is good. Your toenails have good color, no chipping, no cracking, no peeling. They're not yellow, no signs of fungal stuff going on there. Now their foot there, same thing, looks good. And then I'm going to feel your pulses, your popliteal, posterior tibial, and your pedal pulses there. Good. I'm going to check your strength here in your, go ahead and push against me like you're driving a car. Okay, pull your toes back towards you. Good. And then we'll just check your reflexes. So here on your knees, and the Achilles, and this knee, and Achilles. Good. Okay, I'm going to have you stand up for me. I want to look at your back. So looking at your back, it's nice and straight. I'm going to have you go ahead and bend over, touch your toes for me. Your spine is nice and straight there. No kyphosis, lordosis, or scoliosis noted. Okay, go ahead and stand up. Any pain or tenderness in your back?
Nope.
Okay, turn around for me. And just to check the range of motion in your knees, I want you to squat down and stand back up. Pain or tenderness when you do that?
Nope.
Nope. Okay, well, thank you for being my patient today, and this concludes my head-to-toe assessment.